1. A 45-year-old man presents with progressive fatigue and pallor. Labs show HB 8.2 GDL, MCV 72 FL, and ferritin 8 ml. What is the most likely cause? A. Vitamin B12 deficiency. B. Iron deficiency anemia. C. Aplastic anemia. D. Hemolytic anemia. 2. Which of the following is a contraindication to the use of beta blockers in heart failure patients? A. Atrial fibrillation. B. Preserved ejection fraction. C. Symptomatic bradycardia. D. Diabetes mellitus. 3. A 28-year-old woman has a positive pregnancy test and no history of chickenpox or vaccination. What is the most appropriate next step? A. Administer varicella-zoster immune globulin. B. Order a varicella IgG serology. C. Administer varicella vaccine. D. Start antiviral prophylaxis. 4. A patient with COPD is admitted for worsening dyspnea and cough. ABG shows pH 7.32, PaCO2 52 mm of mercury, PaO2 60 mm of mercury. What is the next best step? A. Start high-flow oxygen. B. Initiate non-invasive ventilation. C. Intubate the patient. D. Administer 4 corticosteroids only. 5. Which organism is most likely responsible for community-acquired pneumonia in a young, healthy adult? A. Pseudomonas aeruginosa. B. Klebsiella pneumoniae. C. Mycoplasma pneumoniae. D. Staphylococcus aureus. 6. What is the most appropriate initial test for suspected pulmonary embolism in a pregnant woman? A. VQ scan. B. D-dimer test. C. Chest X-ray. D. CT pulmonary angiography. 7. Which of the following features best differentiates ulcerative colitis from Crohn's disease? A. Presence of fistulas. B. Rectal involvement. C. Skip lesions. D. Transmural inflammation. 8. A 60-year-old male with hypertension develops a sudden, severe headache and neck stiffness. What is the most likely diagnosis? A. Migraine. B. Tension headache. C. Subarachnoid hemorrhage. D. Temporal arteritis. 9. What is the mechanism of action of metformin? A. Increases insulin secretion. B. Decreases hepatic gluconeogenesis. C. Delays carbohydrate absorption. D. Stimulates insulin receptor sensitivity. 10. In a patient with suspected meningitis, what is the most appropriate next step before performing a lumbar puncture? A. Administer corticosteroids. B. Obtain a CT head scan. C. Start antiviral therapy. D. Monitor intracranial pressure. 11. What is the most appropriate management for a 3 cm thyroid nodule with suspicious ultrasound features? A. Repeat ultrasound in 6 months. B. Fine needle aspiration biopsy. C. Start levothyroxine suppression. D. Surgical excision. 12. A patient with a history of 4 drug use presents with fever and a new heart murmur. Which organism is most likely responsible? A. Staphylococcus epidermidis. B. Streptococcus viridans. C. Staphylococcus aureus. D. Enterococcus faecalis. 13. A 30-year-old woman presents with heat intolerance, weight loss, and tremor. TSH is suppressed and free T4 is elevated. What is the most likely diagnosis? A. Hashimoto thyroiditis. B. Graves' disease. C. Subacute thyroiditis. D. Toxic multinodular goiter. 14. A 65-year-old male presents with hematuria and a smoking history. What is the most likely diagnosis? A. Bladder cancer. B. Renal cell carcinoma. C. Nephrolithiasis. D. Glomerulonephritis. 15. Which of the following is the first-line treatment for absence seizures? A. Phenytoin. B. Carbamazepine. C. Ethosuximide. D. Valproic acid. 16. A patient is diagnosed with major depressive disorder. Which of the following is the most appropriate first-line pharmacologic treatment? A. Lithium. B. Bupropion. C. Sertraline. D. Haloperidol. 17. What is the recommended management for an asymptomatic 3 mm renal stone? A. Surgical removal. B. Extracorporeal shock wave. Lithotripsy. C. Observation and hydration. D. Ureteroscopy. 18. A newborn has cyanosis that does not improve with oxygen. Which congenital heart disease is most likely? A. Atrial septal defect. B. Tetralogy of Fallot. C. Patent ductus arteriosus. D. Coarctation of the aorta. 19. A 72-year-old male has a PSA of 14 ml. What is the most appropriate next step? A. Watchful waiting. B. Repeat PSA in 6 months. C. Transrectal ultrasound guided biopsy. D. Start finasteride therapy. 20. What is the most appropriate management for a confirmed ectopic pregnancy in a stable patient with no contraindications? A. Surgical salpingectomy. B. Expectant management. C. Methotrexate therapy. D. Laparotomy. 21. Which vaccine is contraindicated during pregnancy? A. Influenza inactivated. B. Tetanus diphtheria. C. MMR. D. Hepatitis B. 22. A 10-year-old child presents with a limp and hip pain. X-ray shows a flattened femoral head. What is the most likely diagnosis? A. Slipped capital femoral. Epiphysis. B. Septic arthritis. C. Legg-Calvé-Perthes disease. D. Juvenile idiopathic arthritis. 23. What is the recommended management for a patient with unstable angina and ST depression on ECG? A. Immediate thrombolysis. B. Oral nitrates only. C. Urgent coronary angiography. D. Elective stress testing. 24. A 40-year-old man presents with a 3-month history of persistent diarrhea and 8 kilograms weight loss. Colonoscopy shows non-caseating granulomas. What is the most likely diagnosis? A. Ulcerative colitis. B. Celiac disease. C. Crohn's disease. D. Irritable bowel syndrome. 25. What is the most common cause of secondary hypertension? A. Renal artery stenosis. B. Cushing's syndrome. C. Pheochromocytoma. D. Hyperaldosteronism. McKay. The Medical Council of Canada Qualifying Examination or MCCQE is a comprehensive assessment designed to evaluate the knowledge, clinical skills, and decision-making abilities of medical graduates in Canada. It is typically taken in two parts: MCCQE Part 1, a computer-based exam that tests medical knowledge and clinical decision-making across various disciplines, and MCCQE Part 2, a clinical skills examination assessing the candidate's ability to apply medical knowledge in real-life patient scenarios. The MCCQE ensures that candidates meet the standards required for independent medical practice in Canada. Successful completion of both parts is a key step toward obtaining licensure and practicing medicine as a general practitioner or specialist within the Canadian healthcare system. The exam emphasizes evidence-based medicine, patient-centered care, and ethical clinical practice. Here are the top 5 beneficial uses of the MCCQE exam. 1. Licensing requirement. The MCCQE is essential for medical graduates to obtain a license to practice medicine independently in Canada, ensuring only qualified physicians enter the healthcare system. 2. Standardized competency assessment. It provides a national benchmark to evaluate medical knowledge and clinical skills, promoting consistent standards across all candidates. 3. Patient safety assurance. By testing clinical decision-making and ethical practices, the MCCQE helps protect patients by certifying competent and safe physicians. 4. Career advancement. Passing the MCCQE opens doors to residency programs and specialized training opportunities within Canada's medical system. 5. Professional credibility. It enhances a physician's credibility and trustworthiness among peers, employers, and patients by demonstrating proven competence.